What is Ozempic Face, and why is social media driving the demand for this weight loss drug? Stay tuned as we welcome our special guest, University Medical Partners, Dr. Mariam Manoukian. Welcome to Skin Tuition. I'm Heather Furnas.
And I'm Josh Korman. From pimples to wrinkles, our skin affects how we feel about ourselves. As two plastic surgeons, we discuss what's new, what's safe, and what to look for when you're ready to hit refresh. Dr. Mariam Manoukian is a renowned internist and endocrinologist who has many years of experience treating patients with obesity, diabetes, and metabolic diseases. Welcome, Dr. Manoukian.
Well, thank you for having me.
So tell us, Dr. Manoukian, what is Ozempic?
Well, Ozempic is otherwise known as Semaglutide, is medication that is produced by Novo Nordisk, but it's actually an analog of glucagon-like peptide. So first of all, I just want to mention that I'm not sponsored by Novo Nordisk, and I have no actual interest in these drugs except for certainly using not just Ozempic, but other GLP-1s in my daily practice. The GLP-1s, or glucagon-like peptide, is a hormone that is produced by our own intestines. And it affects most importantly, it's produced to not improve, but actually to kind of put the glucose into the right place. It stimulates insulin production. It's like starts that machine of when glucose goes into the person's mouth. So some brilliant people, some years ago figured out that we produce hormones that can affect not only the whole glucose production machine, but also affects our appetite. And those eventually turned into these medications that are, the hormones are called incretins, but they kind of started to separate each one of them. And the first one that came on the market was the GLP-1. It came as several different medications, and most recently, the very famous Ozempic.
I'm going to ask you to back up. So if I take something to eat, I eat something, my food is digested, and then you mentioned glucagon and insulin and glucose. Can you kind of take us through that path?
Yeah, sure. So when a person starts eating, actually anything, not just glucose, but it's actually the production is insulin, the glucose dependent, but anything we put in our mouth, it doesn't have to go down all the way to some place to start the whole mechanism of the so-called metabolism. In the intestines, the production starts of these hormones that start moving things around, like the pancreas produces insulin, even without seeing that glucose yet in the bloodstream. It's actually fascinating. And once the hormone starts being produced, it starts telling the brain, you are eating. So everything starts going in the body. And then once the person is eating some more, then the brain actually starts telling us, you have eaten. So that is actually the satiety that we call a satiety, because I'm eating and then suddenly I feel like, you know what? I ate enough. I have to stop. So what we noticed in diabetes and obesity is that this effect is lost. When they first started to find this out, they thought that there is a deficiency in this GLP-1s, the satiety hormones. But then they found out that there might not be a deficiency, there might be a resistance. So in people with obesity and diabetes, the effect of this GLP-1s or incretins or Ozempic or whatever you want to call the satiety hormones is missing. So hence suddenly that we get this medicine in our hands that is causing satiety becomes so important.
So how much weight can people lose and over what period of time?
It varies, certainly. And I'm sure that we are seeing from some small weight loss to up to 70 pounds. I've seen people losing with time. One of the best things about this kind of medications is that people continue to lose the weight. And one of the reasons is because we have also the dosages are, you can go up on the dose once the person notices that, they're stuck in a sense. So the weight loss can be, like I said, I've seen 70 pounds. I'm sure there are people who lost more. But the interesting thing is pretty much everybody loses weight, which is, I think, is one of the very important things on all the other weight loss drugs that we had before. Not everyone lost the weight, and, people would lose 5% or 10% most of the weight.
So do they lose weight until they reach an ideal weight? Can you overshoot, or how does it work? You mentioned the satiety, so you're satiated, you've had enough, and so you should reach a resting point where you are eating normally. Is that right?
Yeah. I think, eating normally is kind of, it's normal for different people, would be normal differently, and it depends on their resting metabolism, it depends on their activity level, and there are many factors. But yeah, certainly the main mechanism is basically eating less. And frequently people would come and say, oh, I can't eat any less, I'm eating so little and I'm not losing weight. Well, guess what? When they start on Ozempic or the other GLP-1s, they start losing weight because they are eating less, because every person thinks that they're at their minimum eating, but at the end of the day, still they eat more than they should be.
So that's actually really interesting, and brings up a question of what is the measure of obesity? Because obviously people grow up in families where different weights are culturally accepted, not accepted. So what do you use as a measure of obesity?
That's actually a phenomenal question because, first of all, we have these numbers, right? The body mass index that we call obesity when a body mass index is above 30. We call people overweight if their body mass index is 25. But is this true for white people, for Asians, for Hispanics? And plus we have all these thin models that everyone wants to be thin. It becomes really complicated. To me, obesity is when people feel like they're overweight, that it impacts their daily life. It creates a lot of other diseases. Like we know that obesity is a precursor to diabetes, to heart disease, to all kinds of joint pains, to all these knee replacements, all this, and of course, depression. First of all, until 2013, US did not recognize obesity as a disease, which is absolutely ridiculous. If you code it as physician, if you coded a person with the obesity code for a CPT code, insurance would not pay because it wasn't considered as a disease. So finally, we said, fine, this is a disease, just like blood pressure, just like diabetes. Finally, we came up with the idea, hallelujah, that obesity is a disease. It's not like people are doing this to themselves and they should stop doing it. But what is the actual mechanism? Of course, partially it's genetic. It's, of course, environmental, what people eat. A lot of people who are like Bill Maher, he thinks like if we eat less, then everything will be solved. 40 years ago, we didn't have obesity. It's all our fault. It's the fault of the people who put too much sugar in the drinks. Too much drinks have gotten bigger. So there are many, many causes of obesity. And certainly, why is it that US is the most obese country in the world? Why is it that we have 40% of obesity versus France has 17% and Japan has only 4% of obesity? So there are so many factors that are involved in this, but very important for us to understand that obesity is a condition, that it's a medical illness, it's a disease, and it's both physical and it's both mental, because every obese person knows that it's not good to be obese, but they're still eating and they're still gaining weight, right? So it is not just a simple one physical condition. So I think that for us, having finally medications that are truly improving the condition. I think this is just basically revolutionary. And like I said, for me as a physician who's been treating diabetes and type 2 diabetes and obesity for so many years, I'm really happy to have these medications on the market.
What's interesting is that there are a lot of people who are on social media in celebrity circles talking about Ozempic and similar medications for not weight loss when they are obese, but more an aesthetic range, 10, 15, 20 pounds. Now, what is your feeling of that?
I see that all the time in my practice too, when, you almost want to tell the person, hey, come on, you're not obese, you're not overweight. Why are you even worried? But again, this mental component. I mean, not so much men, certainly for this kind of weights, but women, during menopause or, they gain some weight and then it's extremely hard to lose the weight. I personally think that there is absolutely no problem using the medications. I'm certainly not turning them into some skinny models, but getting rid of the abdominal fat and having them lose those 10 pounds that they've been struggling for a long time. I think that's a great idea. I don't see any problem with that.
So in that context of when would insurance cover the medications, and when would insurance companies say this is more of an aesthetic rather than a medically necessary treatment? And in your practice, how do you work with that? And if patients have to pay for it by themselves, how much does it cost?
Well, obviously the medications are very expensive, but they're all brand medications, so they're quite expensive. The two companies that make them, the Novo Nordisk and Eli Lilly, both brand medicines, both have been on the market for many years with great drugs for diabetes. So medication right now, all of them are covered by majority of the insurances for diabetes. For obesity, they're covered if the body mass index is above 31, or people have any medical conditions, which are, depression, asthma, sleep apnea, conditions that are actually directly are related to obesity. So it all depends on the insurance. A lot of them, the coverage is not that bad, truly, but sometimes some insurances would just absolutely not pay. And I would not understand that for people whose BMI is above 30. For people between 25 and 30, that's a matter of luck, in my experience. Sometimes insurances will cover, and they probably have some premium insurances. Sometimes they won't. It's really hard for people, I think, to pay for those. I think they're quite expensive. They're usually around $1,000 a month. As you know, there are all these companies that somehow get this medicine and distribute, and that's another whole big market that I see. And I'm not sure. I've talked to the companies and they're saying that they do not promote those companies. So it's not clear really how the spas and a lot of the places where these medications are given to patients in syringes. I honestly don't have much comment on that.
What are the side effects to these medications?
So any patient who opens the patient PI, the patient information, they just first shock is that it causes thyroid cancer. But the type of a thyroid cancer that is mentioned in the PR is called medullary thyroid cancer. It's extremely rare and it's only shown in rats. So that really is irrelevant. However, because these medications are causing satiety, they will give some nausea, and some people have constipation, rarely diarrhea. Those are the most common side effects of the medications. Amazingly, they're tolerated pretty well. Amazingly. I don't know, maybe 1 in 100 patients would say I can't take it because it gives me too much side effect. The long-term side effects is a question, but that's clear, for all of us working in medical field, we know that unfortunately, a lot of medications are used for many, many years, and then somebody finds something about those. I mean, so far it looks like it's very benign. It's certainly a risk and benefit anytime you take a medication.
So that brings up an important question, like how long should or can people stay on these medications?
In my opinion, probably for a long time or forever. For people who suffer from obesity for many years, I think it's like we treat blood pressure for 25, 30 years. It's possible that it needs to be treated for 25, 30 years. I don't know, whatever, how many years people need it. But for some people, it is possible that with the changing of their lifestyle, with doing their habits change, they notice how much they eat, what creates, certainly if they are, in addition, starting to exercise or making the exercise as a part of their daily routine and changing their habits. I certainly hope that for some people, it's going to be like, particularly those people that you're talking about, 10, 15 pounders who need to lose only that. It's possible that they would eventually not need it. I mean, that remains to be seen.
Or maybe it's a little bit like people who try to use liposuction for their method of weight loss. Like they have it, then they don't, after a bunch of years, they come back again because they've gained some more weight and want to do it again. Maybe that's how it's going to be with these medicines, that they'll use them. And are these pills or are these injections?
No, they're injections, of course. Yeah, it's a once a week injection. That is actually, you need to increase the dosage because at a higher dosages anyway, that's another issue that people notice that when they stay on the same dosage for several months, then it stops working. There is some resistance. But we see that with blood pressure, we see that with diabetes. It's nothing surprising.
So what do people do when they inject? Do they inject themselves? Is it in the skin or deep into the fat?
It's written on the patient instructions, and it's usually, inch or two away from the belly button. Usually people have a lot of, those of you who have done surgeries, you've seen how much fat we have there, right? Even the thinnest people have some fat there. So injection is subcutaneous. The Ozempic pen actually itself is a very high quality pen, and the injections are totally painless. Wegovy, which is what we need to mention, that the same compound, same molecule that is called Ozempic and is used in diabetes, the same compound is called Wegovy, and that is the one that is approved for obesity. And the pens are slightly different. For people to understand that the company took the same compound and called Ozempic and is using it for diabetes, and it called Wegovy, and that is approved for obesity.
So it sounds like you like these medications a lot, that they really do help a lot of patients.
I do, because I see for the first time that I make a big difference in patients' lives. And I used to have a weight loss clinic that was called a 52-week weight loss clinic, and closed it because I felt like I cannot help patients, because by teaching them how to eat, how to exercise, hiring a cook, nagging them every week, checking them at the end of the year. First of all, a lot of people dropped out because they lost some weight and then they gained the weight back. We've seen this with every single weight program. People lose some, and if you nag them all the time, you might have some success. I'm certainly extremely against all the liquid diets that have been used. Yes, people lose weight, and then all that weight comes back. Now, is this going to have the same fate if you suddenly tomorrow all the Ozempic or Wegovy disappears off the market? I don't know, because this is a chronic disease. You cannot just treat it for 5 minutes and then expect the benefit forever. That's what the patients need to understand, that there is nothing that I lost the weight and it's gone. No, it's a chronic condition. It's a chronic medical disease that needs to be constantly treated. And the lifestyle is a treatment. It's not just the psych stuff. Eating healthy and exercising is a way of treatment, but so are these important medications, of course.
There's another medication, Mounjaro. How is that different?
So like I mentioned, Eli Lilly is the other company that makes and Eli Lilly made this Mounjaro, which is again a GLP-1. And plus they added another satiety hormone that is called GIP. Also very successful medication right now. It is only covered for diabetes. And I certainly absolutely like the way it works because you can't do anything better than help the type 2 diabetic to lose weight. Because for years and years and years, we treated type 2 diabetes to this number, which is called A1C, to improve their A1C with any means. And the any means meant insulin and all the drugs that help these people to gain weight and gain more problems from the weight. So finally, we have medications that actually help them to lose weight and frequently reverse diabetes, which is, oh my God, we're finally doing exactly the right thing.
So let's expand it a little, because from what I've read, not only do these medicines clearly help with obesity and diabetes, but they actually may help with other things like anxiety or depression. What have you found?
Yeah, so because obesity is this very complicated physical and mental condition, the way this vicious cycle works in people is that they're trying to eat healthy. They're trying to eat healthy. They're trying to eat healthy. And then nothing happens, because their healthy is a lot more food. Like, I can't tell you how many times I hear from my patients, my problem is the, morbidly obese person. Why do you think you have so much weight? Because I don't eat enough protein. No, that's not the problem. The problem is that people try to fix their eating. Nothing happens. They don't lose the weight because they're still eating too much. They maybe eat less than what they thought. And then they don't lose weight. And then they extremely depressed. They have the sugar blues. They eat the sugar. And then they gain the weight again. And then they're so anxious. They're so unhappy. So a lot of the obese people are very anxious, very depressed. I had a patient who said she could not listen to her child playing at a Carnegie Hall because she saw some cookies outside of the hall that she had to go and get those cookies. It's a severe addiction. So what Ozempic does, what, GLP-1s do, they basically get rid of those addictions. And that's such a relief for people. It's finally, you're not addicted to food. They take the food out of their focus. And that makes people very happy. So, not only when I see people who have lost quite a bit of weight, they're happy because they can exercise, they can walk up a hill, they can run upstairs, they can do things. They're also feeling very relieved because they don't have that terrible vicious cycle. I'm going to eat, then I'm going to blame myself. I'm going to try losing weight, and then that doesn't happen, and I go eat again. I think that cutting that vicious cycle is what these medications do, and that helps with anxiety. It helps with depression. There is actually other phenomenal data that shows, which is well known, which helps with heart disease. It's a cardiac protector because of the weight loss or because of whatever other reasons, but it also helps with lowers the heart failure. It does other positive things to the body.
Now, there are other addictions that it may help with, like alcohol and even shopping, online shopping.
I read about that too, and I see that in my patients too. I did not realize that a lot of these addictions, well, first of all, we know they're very connected and they light up the same centers in the brain. The addictions are very similar. So I've read about that too, that it can help with a shopping addiction or with, certainly it would be interesting to see. A lot of the obese people do not smoke. So their addiction is to food, not to smoking. And kind of, in a sense, they're all addicted to different things.
So we started this show by mentioning something called Ozempic Face, which is getting a lot of press in the social media world. But what have you found with that?
Interesting enough, I'm assuming that people have saggy skin after weight loss. That's what's the Ozempic Face is probably. And I've seen that a lot when people lose a lot of weight. Now, again, this is my personal experience, and that I do not see that as much because the weight loss is it's just such a beautiful weight loss in a sense that people lose 2 to 4 pounds a month. So there is time for the body. It's not like after what we see with the weight loss surgeries. When I'm talking about 70 pounds, I see that in a year. It's not happening very quickly. Just people notice how well they feel. That is what we notice. So honestly, I don't have much. I haven't seen any Ozempic face in my practice, but I would think that when people lose weight, they would be interested in fixing the skin just like in other weight losses, or not.
I know I find in my practice that, as you mentioned, the massive weight loss surgery, the bariatric surgery, the body does not have time to recover. And so the quality of the skin is damaged so that the elasticity is gone. Whereas if people lose a lot of weight through their own diet and exercise, which I guess that's what this is. This is sort of an accelerant to the diet and exercise, that it's much easier to do surgeries on them that create significant improvement. The massive weight loss surgery also, clearly there's a lot of skin, you take it off, but it certainly seems more logical. Heather, what have you found in your practice?
Yeah, the massive weight loss surgery patients, the tissue is always different. Blood vessels remain very large, so bleeding is an issue. But nutrition is an issue, particularly depending on the type of massive weight loss surgery. And these patients need to take supplements. Sometimes they don't heal as well, simply because of the absorption. So, Dr. Manoukian, I wonder if these medications will replace massive weight loss surgery.
Absolutely. Absolutely. I think it should actually. There is going to be some room because, that there is a kind of a type of a genetic obesity. There still might be some room, but, before I used to refer a lot of people to weight loss surgeries. This newer weight loss surgery, certainly what we're talking, I guess what you've seen, most people had the Roux-en-Y surgery. The more gastric sleeve is kind of a less nutrient, kind of people still absorb the nutrients because most of the small intestine remains. But I think that these medications will help us to avoid the surgeries, and they are actually used in children now, in younger adults, which I think is great because we always think the kids should do this, should do that, they should eat healthy, their parents should be this and that. But at the end of the day, we have a major obesity problem in children. So yes, I'm hoping that with using these medications and learning more, I'm hoping that more is going to come, with this, now that we figured out that we have this GLP-1s and that, 30 years ago, no one had any idea about this mechanism. So I think that absolutely it should be replacing right now and for,
So what, in your experience, and I don't know if it's been around long enough to know, but what happens when people who are on these medications stop? Is it something they should stop gradually? They should stop right away? And what happens?
I'm sure there is some data. I'm sure pharmaceutical industry has some data. Sometimes it's going to happen. I don't know, honestly. I cannot answer that question. I can tell you from my experience, knowing that this is a chronic disease, I think that in a lot of people, the weight is going to come back. Now, is it going to come back fully or it's going to come back less, since hopefully they brought those new techniques into their life, that they've started to love exercise, or, people who exercise in general will do better no matter what that is. But a lot of people who are overweight, exercise for them is a torture. They just are not used to exercising, and telling them about at least starting something. I'm hoping that exercise and lifestyle, and for them to understand they should not be drinking soda, they should not be eating too much meat, they should not be eating sugary foods and fried foods and fast foods, all these things that we've been saying before. Hopefully now they notice that since there was a hope, it worked. Hopefully they've implemented these changes. But that the weight will come back, I have no doubt. that some of it will come back. Now, for people who lose just those 5-10 pounds, maybe they can keep that off. We have to see. Talk to me in a year. I'll definitely will know the answer to that question, because sometimes the patients run out of medication, and I try kind of teaching them how to maneuver a little bit, how to stretch the dosage into 2 weeks instead of 1 week, how to play around with the medications. But, we have to see what happens, because a lot of people would like to stop it. This is in people's mind that, I'm going to lose the weight and I'm going to be fine. So we'll see.
And what are the programs like with children? Do they anticipate these children will be on these medications lifelong, or is there an attempt to make it short-lived?
Yeah, I don't know. But right now, the children are for a long time on the medications. And certainly, again, like in children, the change is probably easier to achieve, hopefully by changing the lifestyle and teaching these kids. Of course, it's hard to imagine that someone needs to be 70 years on a medication, right? Yeah, hopefully not.
Okay, it's tremendous. It's wonderful. Is there anything else you'd like to include?
Well, again, mentioning that this is not a promotional talk. I just wanted to share with you the difficulty in general treating of these conditions, and I know that you being in plastic surgery probably have seen that too. It's really a condition that is really, really hard to treat. And people want to be thin and they want to look good. And for that, it's one side of the story. But the other side is all these medical illnesses that come from the weight. And I'm just very excited that we have that now, that we help people to lose weight, to actually reverse diabetes. We can call them diabetes reversing drugs. So exciting times.
Thank you, Dr. Manoukian. It's been a pleasure to have you. This is Skin Tuition. I'm Heather Furnas.
And I'm Josh Korman, and we'll see you next time.
Bye-bye.